Introduction. An abscess is a confined collection of pus surrounded by inflamed tissue. Treatment of an abscess is primarily through incision and drainage, IND. Smaller abscesses, 5 mm, may resolve spontaneously with the application of warm compresses and antibiotic therapy. Larger abscesses will require IND. Incision and drainage of abscess, e.g., carbuncle, suppurative hidradenitis, cutaneous or subcutaneous abscess, cyst, furuncle or paronychia, simple or single, complicated or multiple. Physician makes a small incision and leaves the surgical wound open to allow for continued drainage. In 10,061, the physician may place a Penrose latex drain or gauze strip packing to allow continued drainage. Complicated cysts may require later surgical closure. The patient's abscess was located left medial thigh. Area was anesthetized with 10 ml of 1% lidocaine with epinephrine. The abscess was incised with a scalpel and moderate amount of purulent drainage was expressed. Penrose latex drain was placed. The patient tolerated the procedure well. The patient's abscess was located left arm. The abscess was incised with a scalpel and moderate amount of purulent drainage was expressed. The patient tolerated the procedure well. The patient's abscess was located in left and right knee. Both abscesses were incised with a scalpel and moderate amount of purulent drainage was expressed. The patient tolerated the procedure well. Incision and drainage of pilonidal cyst, simple. Complicated. Pilonidal cysts are located in the sacrococcygeal region above the buttocks. An incision is made to allow drainage of cystic fluid or exudate. Curettage is performed to remove the cystic epithelial lining. The wound heals secondarily depends on local wound care. Report 10,081 if the procedure is more complicated and requires excision of tissue, primary closure, and / or Z-plasty. Pilonidal cyst was anesthetized with 10 ml of 1% lidocaine with epinephrine. The cyst was incised with a scalpel and high amount of purulent drainage was expressed. Procedure required excision of tissue with Z-plasty wound closure. The patient tolerated the procedure well. Example 10,080. Pilonidal cyst was anesthetized with 10 ml of 1% lidocaine with epinephrine. The cyst was incised with a scalpel and low amount of purulent drainage was expressed. Wound is left with open. The patient tolerated the procedure well. Incision and drainage of hematoma, seroma or fluid collection. Physician makes an incision. A hemostat bluntly penetrates the fluid pockets, allowing the fluid to evacuate. A latex drain or gauze packing may be placed into the incision site. Any drain or packing is removed within 48 hours. The incision can be closed primarily or may be left to granulate without closure. Example 10,140. Type, hematoma. Location, left leg. Local anesthesia, lidocaine. Incision, 15 size scalpel blade. Materials used, hemostat. Drain, latex. Incision and drainage, complex, postoperative wound infection. Physician first removes the surgical sutures or staples and / or makes additional incisions into the skin. The wound is drained of infected fluid. Any necrotic tissue is removed from the surgical site and the wound is irrigated. The wound may be sutured closed or packed open with gauze to allow additional drainage. If closed, the surgical site may have suction or latex drains placed into the wound. If packed open, the wound may be sutured again during a later procedure. Incision and drainage of finger abscess, simple. Complicated, e.g., felon. The physician drains an abscess located in a finger. The physician lances an abscess located in the cutaneous tissue of a finger. In 26,011, the abscess just reaches deep subcutaneous tissue and requires debridement and irrigation. The wound may be left open to drain. Incision and drainage abscess, peritonsillar. The patient is given a topical anesthetic or placed under general anesthesia. Using an intraoral approach with a mouth gag, the physician incises the mucous membrane of the abscess. The abscess cavity is opened with angulated closed forceps or hemostat. The wound is irrigated and left open. Incision and drainage, perianal abscess, superficial. The perianal skin over the abscess is incised and the abscess cavity is opened and drained. The incision is packed open for continued drainage. Incision and drainage of vulva or perineal abscess. The vulva includes the labia majora, labia minora, mons pubis, bulb of the vestibule, vestibule of the vagina, greater and lesser vestibular glands, and vaginal orifice. The perineum is the area between the vulva and the anus. The physician makes an incision into the abscess at its softest point and drains the purulent contents. The cavity of the abscess is flushed and often packed with medicated gauze to facilitate drainage.